We've seen the general OR setup. Now I'd like to show you how to set up a trauma room. The trauma room just has a couple more additions. The couple of extra additions would include a double transducer set. A double transducer set is set up with a pressure bag, a 500cc bag, with two transducer tubing spiked. The two transducers that we would need in a trauma situation are an arterial line and a central line with thin tubing pointing up. Make sure that you connect it to the transducer wires and zero them prior to the patient entering the room. To set up a transducer, you take your 500cc normal saline bag and you first attach to the hook in the pressure bag, like so. You then take the pressure tubing make sure all the junctions are tight. Oftentimes they're quite loose. Remove the plastic sheet that covers the insertion site. This has to maintain sterile. And spike the bag. Once spiked, this pressure bag can now be inflated. To inflate, this needs to be off to air. A little bit above 250 milligrams of mercury, you'll notice that the pressure bag is adequately inflated. To make sure it stays maintained, the stopcock must now be off to the pressure tubing. Finally, to make sure that you are not going to give your patient any air, you have to prime the tubing. Every transducer has a flush line. You flush and turn this off to this site, flush the line till it's off to this site and the air bubbles are out, and finally flush to the end and examine the tubing to make sure there's no air bubbles. This transducer can be used for any of the following: A line, central line, PA, or LAP. For purposes of today, I'm going to label this the arterial line, with the thin tubing going up. This is the tubing that will connect to the patient. The general setup of drugs that you may need in any case at Yale would include a phenylephrine strip, 0.1 milligrams per cc, ephedrine, 5 milligrams per cc, atropine, a stick of lidocaine in a 5 cc syringe, propofol in a 20 cc syringe, succinylcholine in a 10 cc syringe, rocuronium in a 5 cc syringe, midazolam in a 3 cc syringe, and fentanyl in a 5 cc syringe. Finally, every trauma room should have their respective trauma boxes. In the trauma box, you will find a fresh stick of epinephrine, a fresh stick of nitroglycerin, sticks of etomidate if required, succinylcholine, propofol, calcium, lidocaine, steroids, and almost every type of drug that you may need in a trauma situation. In a trauma situation, you want to make sure that you have an A-line set up. That includes an A-line board with gauze taped down, tape for which you would use to tape the patient's arm down to the board in order to open up access to the radial artery, the actual arterial line catheter, chloroseptic stick to clean the skin, and prior to taping the tubing to the arm, make sure to use benzoin so it will stick nicely on the skin. After you gain access to the arterial line to get the most accurate blood pressure readings, oftentimes patients who are in trauma situations may also need central access. This may involve a triple lumen 7 French central line kit, a Cordis 9 French central line kit, and with the Cordis, possibility of using a Swan. The Cordis allows for rapid transfusion of blood and also to gain access to more information about the patient via the use of a PA catheter. I've attached 2 flushes with 2 stopcocks to be attached to the lines as well, with an 18-gauge angio cap if needed.